Have you ever received a bill from your doctor's office and been completely stunned by the numbers reflected back at you? I have. A year after my son was born, I received a bill for nearly $6,000. The funny thing was that this was just for the anesthesiologist, that I only needed because I had an emergency C-section. What are you supposed to do in that situation? In that moment when they tell you your baby's in distress and that you need to go into emergency surgery? Am I supposed to ask how much it's going to cost and make my decision based on that? Fortunately for me, this was a mix-up between my insurance company and the hospital, and I only ended up paying $21 of the nearly $6,000 that I was billed for. Now, I work in healthcare, so I am acutely aware of what my insurance covers and what my benefits are. However, this isn't the case for everyone. I see patients every single day who don't understand their benefits, some that don't even know who their insurance carrier is because they receive their insurance through their employer. Typical insurance is broken down into 4 major categories. You have your deductible, your copay, your max out of pocket, and your coinsurance. So the most typical is your copay. Your copay is going to be something that you pay upfront, typically for, say, a doctor's appointment, a walk-in clinic visit, or going into the emergency room. This can range from $25 to $100. Then you have your deductible. Your deductible is typically what you have to meet before your insurance will start to pay anything towards your bills. So for instance, or to give you an idea of what the Washington average single person deductible is, that is $1,793. And the average family deductible is $3,435, according to KFF.org. That is just what you have to pay before your insurance even kicks in. The next category is your max out of pocket and your coinsurance. So your max out of pocket, or your MOOP, as I like to call it, is another checkpoint you have to hit before your insurance will cover 100% of services. According to healthcare.gov, your max out of pocket cannot be more than $8,550 for an individual and $17,100 for a family. A good breakdown of how your deductible and max out of pocket work together is this example that I found on Cigna's website. Jane Q has a health plan with a $2,500 deductible, 20% coinsurance, and a $4,000 max out of pocket. At the start of her plan year, she has an unexpected illness. She sees her regular doctor and a number of specialists. She goes through a lot of medical tests. She receives medical bills totaling $2,500 and pays these out of her own pocket. It also counts towards her out-of-pocket maximum. She continues to see specialists regularly and has to do another round of tests. She pays 20% coinsurance as her share of these medical costs, while her health plan pays the other 80%. Her bills amount to $1,500. This also counts towards her max out of pocket. At this point, Jane has spent a total of $4,000 and has met her max out of pocket for the year. Now her health plan will begin to pay 100% of her costs for her health plan for the rest of the year. Even if we use this example, this is still $4,000 that you would be required to pay out of pocket. And I mean, after this last year and the COVID-19 pandemic, it has been pretty clear that average people don't have this kind of money just laying around. Now, if the United States offered a program like Medicare for All, we would have no copays, no deductibles or max out of pockets, no more confusing or mild scares when you receive a medical bill. You wouldn't have to put filling a prescription above putting food on your table, or avoiding the doctors because you're afraid you can't afford it. Think about this the next time you're at the polls. Medicare for All would not only benefit you, but it would benefit everyone in the United States. Having access to healthcare should not be a luxury. It should be a right. Thank you.